A few more questions, then we'll wrap it up. We spend over 18% of our GDP on healthcare. That is almost double what any other country spends. And as broken as our general healthcare system is, it seems to me that our primary healthcare system is even more broken, with tens of millions of people not able to get to a doctor when they get sick. And I have talked to physicians in Vermont and around the country who tell me that people walk into their offices very, very sick, and sometimes with incurable illnesses that could have been dealt with if they walked in the door on time. And they didn't because they didn't have insurance. They were embarrassed not to have any money to pay. In your judgment, number one, would, at a time when we spend so much more than other countries on healthcare, if we provided at least primary healthcare to every man, woman, and child, we've had primary healthcare accessible to everybody, in the long run, would it save our healthcare system substantial sums of money? Ms. Vera, you're jumping to answer that?
I am, Senator. Thank you so much for the question. And I would say yes, maybe. But because the maybe is you also need to make sure that they not only have access, but the work is being done to connect them to the appropriate services. Because just having the access, it doesn't connect people to the appropriate services. Quality and population health management does.
But that runs us into another issue, again, having to do with the fact that we're the only major country not to have a national health care program. So somebody walks in, and you make a diagnosis and say, well, sorry, you have breast cancer. Oh, but I can't afford the other treatment that I need, or I'm going to go medically bankrupt as a result. All right, who else wants to jump into the issue of the morality of providing health care to all people at a time when we don't talk about it very much, but studies that I have seen suggest that we lose over 60,000 people a year who don't get to a doctor on time, and that if we don't treat people, you said it, an ounce of prevention is better than a pound of cure. Are we spending on the cure, the tertiary health care, the $100,000 surgeries, rather than making sure people have the medicine and the primary health care they need? Amanda?
So I appreciate you putting it in that context, and I will just call out some of the comments that Senator Cassidy made earlier, that this is the wise investment. And to your point, it is about keeping people healthy. So if you keep them healthy on the front end, if you keep them out of the emergency room, if you keep their chronic diseases managed, if you keep them from getting severely ill, which you can do in health centers, yes, it is going to serve, and it is meaningful for the 100 million people that we've called out today, but really for everyone. Primary care is the path to success in healthcare, period.
Yes, Dr. Noka.
I would just add that a long history of research on primary care generally, specifically looking at comparative performance of health systems across countries, has reinforced that a strong, high-functioning primary care system is associated with a broad range of health system outcomes that we look for.
Is it fair to say that specifically in terms of primary care, we invest far less than other major countries?
Absolutely.
And that is perhaps one of the contributing factors why we end up spending so much per person on health care. Is that a fair?
That would be fair.
Yeah, okay. All right, well, listen, let me thank the panel for being here. You were great. We're talking about a major issue of concern to the American people, and it is my determination to do everything we can to come up with legislation that will improve and expand community health centers in this country and move us toward the goal of making sure that every person, no matter where they may be, have access to primary health care. So that is the end of our hearing today. I want to thank all of our witnesses for the participation. For any senators who wish to ask additional questions, questions for the record will be due in 10 business days. That's March 17th at 5 p.m. Finally, I ask unanimous consent to enter into the record a statement from Senator Casey and statements from stakeholder groups outlining their priorities for community health